Federal Secretary of the Ministry of Narcotics Control, Ms. Humaira Ahmed, Representative, United Nations Office on Drug and Crime of Country Office, Dr. Jeremy Milsom, Excellencies, distinguished guests, media friends, ladies and gentlemen, good noon to you all. My name is Rashida Niazi, and I will be hosting today's show. We start this ceremony with the recitation of the few verses from Holy Quran.
بسم الله الرحمن الرحيم قل أعوذ برب الفلق من شر ما خلق ومن شر غاسق إذا وقب ومن شر النفاثات في العقد ومن شر حاسد إذا حسد.
Jazakallah. On behalf of United Nations Office on Drug and Crime, UNODC, Pakistan, I welcome you all to the launch of the World Drug Report 2022. The International Day Against Drug Abuse and Illicit Trafficking, the World Drug Day, is marked on 26th June every year to strengthen action and cooperation in achieving a world free of drug abuse. And each year, individuals like you, entire communities, and various organizations all around the world join in observing the World Drug Day to help raise awareness of the major problems that illicit drug pose on the society. This year, the theme is addressing drug challenges in health and humanitarian crisis. From war zones to refugee camps to communities torn apart by violence, people in all parts of the world are in dire needs. This year, UNODC is addressing transnational drug challenges stemming from situation of crisis. On this World Drug Day, every year, UNODC issues the World Drug Report, including key statistics and factual data obtained through office sources, a science-based approach, and research. So may we kindly invite Dr. Jeremy Milsom, the country representative of the UNODC, to deliver Executive Director of UNODC, Ms. Wale, message on the World Drug Day. Thank you.
Thank you. Respected Ms. Humaira Ahmed, Federal Secretary, Ministry of Narcotics Control, Brigadier Akhtar Alim, Chief of Staff, Headquarters Anti-Narcotics Force, Excellencies, distinguished guests, ladies and gentlemen. It's an honour and a pleasure to be with you here today to launch the World Drug Report 2022. Each year, UNODC issues this report based on data received from member states, which provides a global overview on the supply and demand of opiates, cocaine, cannabis, amphetamine-type stimulants, and new psychoactive substances, and the impact on health around the world. The report this year includes an analysis of the relationship between illicit drug economies and situations of conflict and delves into the nexus between drugs and the environment. Illicit drugs cause suffering around the world, and criminal groups continue to profit from the misery it causes. Pakistan faces major challenges due to the high levels of drug production, and that's both illicit opiates and synthetic drugs across the border in Afghanistan. Pakistan is making strong efforts across all fronts related to countering the illicit drug trade, and I would like to commend Pakistan for making a difference globally in this field. It is one of the countries making the highest seizures by volume, taking drugs out of circulation that were destined for other countries around the world, and this is done often with great sacrifice. It has spearheaded global initiatives on increasing prevention efforts in educational settings. It's strengthening prevention and treatment efforts across the country to account for changing drug threats. We all must join hands to prevent and counter drug trafficking and abuse, and I thank all those in government, health, law enforcement and education sectors, as well as civil society partners and private sector partners that are committed to making us safer from the harm that illicit drugs cause. And as mentioned, I have the honour today to read out our Executive Director's message. So this is the message of Ms. Garda Valley, the UNODC Executive Director on International Day Against Drug Abuse and Illicit Trafficking. The harms of illicit drugs can affect, the harms of illicit drug use can affect anyone, but they often have the deepest impact on those in crisis. The pandemic undermined physical and mental health, strained healthcare systems and disrupted drug treatment and services. Instability from Ukraine to Afghanistan to Africa and beyond has increased the number of people in need of emergency assistance. The industry of illicit drugs continues to ramp up during these challenging times. In 2020, more than 280 million people around the world used drugs. Seizures of synthetic drugs have multiplied in the last 10 years, while the opioid crisis in North America claims more lives every year, and non-medical use of tramadol continues to endanger people in Africa and the Middle East. Even as we work for long-term sustainable solutions, there are people who need urgent access to treatment and care now. We need to reach those who are most difficult to reach because they need us the most. People in refugee camps and humanitarian settings, people at risk of being left behind as a result of the pandemic, and people facing barriers of stigma and discrimination. Women are among the foremost victims of conflict and crisis, and they often face greater barriers to treatment for drug use disorders. In some parts of the world, the proportion of women among treated patients is below 10%. We need to ensure access to care for all, including in emergencies. We also need to ensure that controlled medicines are available for pain relief around the world and in humanitarian settings. At the United Nations Office on Drugs and Crime, we are committed to providing care and support to the people affected by illicit drugs, no matter the circumstances. Everyone has a role to play, from government to civil society to individuals, in bringing the necessary attention and resources to this issue, and we stand ready to work with all of you. Let us show those who need us that we care by providing the care that they need in times of crisis. And that was the message of Ms. Garda Valley, the UNODC Executive Director. And I'll conclude my remarks there. Thank you very much.
Thank you, Dr. Milsom. Yes, we are committed to provide care, support to the people affected by illicit drugs, no matter what the circumstances are. The 26th June, on the World Drug Day, UNODC launches its flagship publication, the World Drug Report. It provides a wealth of information and analysis to support international community in implementing international drug policy commitments through 5 booklets. These 5 booklets, there, the booklet 1 presents the summary and policy implications. The booklet 2 offers a global overview of the drug demand and drug supply. Booklet 3 explains drug market trends of cannabis and opioids. The booklet 4 presents the drug market trends of cocaine, amphetamine-type stimulants, and psychoactive substances. And booklet 5 includes the finding on the drugs and environment. I would like to invite Dr. Kamran Niaz. He's epidemiologist from Drug Research Section and Trend Analysis Branch at UNODC Vienna office at headquarters, to share the key findings of the World Drug Report of 2022. He is going to join us from Vienna through Teams, so I give control to the computer people.
Presentation. Yes, they're on screen.
Okay, that's fine. Ladies and gentlemen, good morning, good afternoon. It's my pleasure and honor to present to you the key findings of the World Drug Report 2022. And as Ms. Niazi explained, the World Drug Report comprises of 5 booklets, and he also explained the contents of each of those. I can only say that the 5th booklet each year is based on a special thematic topic, and for this year we have looked at one such topic, which was the impact of drugs on the environment. And I'll present some of the findings from that booklet as well in the main findings that I'll present to you. Talking about some of the key findings, if you look at cocaine, the cocaine market has reached a record high. Cocaine manufactured reached a record high in 2022, around 2,000 purity adjusted metric tons. The trafficking of cocaine likely continued to increase in 2020 despite the pandemic, as global cocaine sales unadjusted for purity had increased to a new record high of nearly 1,400 tons. Similarly, as we have seen through the SIGIR data, trafficking by sea, mainly in shipping containers, of cocaine is growing, which accounted for nearly 90% of the cocaine seized globally. Similarly, SIGIR data suggests that trafficking is expanding to other regions outside the 2 main markets, that is North America and Europe, with increased levels of trafficking to Africa and Asia, and that you can see on the map on the right-hand side. Also, multiple indicators point to an overall increase in cocaine use over the past decade, and early indications suggest that the use is rising again in 2021 after a short decline during the corona pandemic. Often the question is asked that what is the most harmful drug? And obviously opioids remain the most harmful drugs, accounting for nearly 70% of the deaths, as well as for disability adjusted life years attributed to drug use disorders. However, cannabis use accounts for a substantial share of global drug-related harm due in large part to its high prevalence rates. Some 40% of the countries reported that cannabis as the drug related to the greatest number of drug use disorders, and 33% of the countries reported cannabis as the main drug for those in drug treatment. So overall increase in cannabis use are posing new burden to healthcare systems. In Africa and some countries in Latin America and the Caribbean, the largest proportion of people in drug treatment were for cannabis use disorders. Again, as the potency of cannabis products has increased, together with regular and frequent cannabis use disorders and psychiatric comorbidities have also risen in Western Europe as an example. Cannabis use accounted for 1/3 of people who entered specialized drug treatment services in the European Union in 2019. But again, if you look at the graph on the right-hand side, there are clear regional differences in the primary drug reported by people entering drug treatment. In Eastern and Southeastern Europe and most of Asia, opioid use disorders were the leading cause for people in drug treatment. In most of Latin America, it was cocaine use disorders, and in East and Southeast Asia and Australia and New Zealand, it was amphetamine-type substances, in particular methamphetamine. Another key finding in the World Drug Report is on drug use among women and men. As you can see in the graph, perhaps it may not be too visible to the audience, young people typically report a higher level of drug use than do adults. In many countries, drug use levels among young people are higher today than in the past generations. Adolescents aged 15 to 16 have a global annual prevalence of cannabis use of 5.8% compared with 4.1% of the population aged 15 to 64. Also, if you look at the treatment admissions, the majority of people being treated for drug use disorders in Africa and Latin America are under the age of 35. Then if you look at drug use among women, while it's obvious that the large majority of people who use drugs continue to be men, but women make up nearly an equal share of those who use amphetamine-type substances and those who engage in non-medical use of pharmaceutical stimulants, pharmaceutical opioids, sedatives, and tranquilizers. Cannabis, which is considered the most used drug worldwide, is also used more by men than women, but the gender gap is narrowing, notably in North America, where the level of use is particularly high. That you can see in the bottom graph. Again, while fewer women than men use drugs, those women who initiate drug use tend to progress to drug use disorders much faster than men. And while that is an issue, access to and availability of treatment services, and more so of services that address the special needs of women, remain an issue in almost all parts of the world. And I'll present you some of the other insights that we have from the World Drug Report 2022. And one of them, as I had mentioned, is the impact of illicit drugs on the environment. So overall, if you look at that impact of drugs on the environment, it's not significant at the global level. But the effects can be significant in terms of the global community or individual level impact. And one of the graphs that you see on the left-hand side is the waste from synthetic drug production and the borders with Netherlands and Belgium. So for some communities, the amount of drug waste produced during the manufacture of synthetic drugs can be substantial. The waste generated during the synthesis processes of synthetic drugs such as amphetamine, methamphetamine, and MDMA is between 5 and 30 times the volume of the end product. The use of precursors and precursors increases the amount of waste. The dumping and discharge of waste created in drug manufacture can have an impact on the soil, the water, and air, with indirect effects on organisms, animals, and the food chain. Cleaning of seized synthetic drug waste storage sites or manufacturing laboratories is a costly endeavor, but it can create risks for public safety and security. Also then, if you look on the right-hand side, illicit drug cultivation often takes place in fragile ecosystems, and here we are presenting two examples from Colombia. So those ecosystems in which drug cultivation may be happening have a protected status, such as national parks and forest reserves, and those can act as a driver or catalyst of deforestation. Deforestation associated with illicit coca cultivation, as we have seen in Colombia, can be substantial. Some alternative development projects do include environmental protection components, such as reforestation and agroforestry in their schemes. Moving on, if you look at the carbon footprint of the drug supply chain have a large carbon footprint impact per quantity produced. For example, 1 kilogram of cocaine has a carbon footprint which is 30 times greater than 1 kilogram of coca beans. The carbon footprint of cannabis grown indoors is mainly due to its energy use, an average of 16 to 100 times greater than that of outdoor cannabis. Moving on to one of these special focus that we had in the World Drug Report this year on assessing the impact of cannabis legalization. Although it's too early to determine the impact of cannabis legalization in some jurisdictions in the world, but I think it's important to understand that the entire debate around cannabis legalization is quite confused with the terminology of depenalization, decriminalization, and legalization, and often that is like all of those are taken as one, where they are quite distinct. Similarly, allowing the non-medical use of cannabis products and allowing the medical use of cannabis, and the non-medical use of cannabis kind of like becomes conflated as one, and people think that while there is the medical use of cannabis, why cannot there be the non-medical use of its of the products? However, from the little evidence that we were able to put together, what we can tell for now about the impact of cannabis legalization is that the proportion of people with cannabis legalization seems to have accelerated the upward trends in reported daily use of the drug, with the pronounced increase in reported frequency of use of high-potency products among young adults. In contrast, what we see, the prevalence of cannabis use among adolescents has not changed much. The proportion of people with psychiatric disorders and suicides associated with regular cannabis use has increased, as has the number of hospitalizations due to cannabis use disorders. Cannabis products have diversified, and average levels of THC in the various cannabis products have continued to increase to levels up to 60% of THC in some markets. The growing influence and investment of large corporations, including those in the alcohol and tobacco sector, is evident in the legal cannabis industry. Tax revenues from the legalized market have continued to rise, but they are a small proportion of the overall revenues of the jurisdictions. The illegal cannabis market is shrinking in some jurisdictions, but it continues to exist alongside legal markets. And finally, legalization has led to a major reduction in the number and rates of arrest of people for cannabis-related offenses. However, since possession of cannabis remains a criminal offense for minors, legalization has not led to a substantial reduction in youth arrest rates. Looking at drugs and conflict, illicit drug economies can flourish in situations of conflict and where the rule of law is weak, and in turn can prolong or fuel that conflict. Plant-based drugs such as cocaine and opiates have been used in the past by parties to a conflict to finance that conflict, for example, in Colombia and Afghanistan. Parties to a conflict have also used the illicit drug trade to generate income by levying taxes on the drug trade, for example, in the Sahel, among other regions. Information from the Middle East and Southeast Asia suggests that conflict situations can act as a magnet for the manufacture of synthetic drugs, which can be manufactured anywhere. This effect may be greater when the conflict area is near larger consumer markets. Conflicts may also disrupt and shift drug trafficking routes, as seen during the Yugoslav wars, with heroin trafficking routes through the Balkans, which remain among the key trafficking routes for opiates from Afghanistan. And more recently in Ukraine, where accounts suggest drug trafficking may have decreased since early 2020. Moving on to some of the dynamics that we need to watch is the further developments in the global opiate market, which largely depends on the situation in Afghanistan. Afghanistan accounts for 86% of illicit opium production in 2021. The 2021 harvest took place from April to July, before the takeover by the de facto Taliban authorities in August. Since then, they have imposed a ban on drugs rather recently, but we have yet to see the effect of that ban on the drug cultivation, production, and trafficking. However, global opium production had followed the long-term upward trend over the past 2 decades, and in 2021, the production was up by 7% as from the previous year, primarily as a result of higher opium yields in Afghanistan. So in the report itself, you can read more in details the three scenarios that we have presented on the impact of the situation in Afghanistan on the global opiate market. Moving on, we also looked at the evidence on impact of eradication, which shows that better long-term effects of voluntary eradication that is implemented with alternative development initiatives as opposed to forced eradication that has resulted in a greater increase in cultivation at a later time. Again, you can read more details of this in the report itself. Looking at the impact of COVID-19 on drug use, there are signs that drug use patterns may have become more harmful during the pandemic. More recent data from studies into the early impact of COVID-19 pandemic on drug use shows that the frequency of cannabis use and the quantities used have increased while the number of users has remained stable. At the same time, there were less access to services for prevention, treatment, and prevention of infectious disease and overdose for people who use drugs. Moreover, the data shows the shortage in drug treatment provision during 2020 in all regions. Moving on to some of the other areas, we see methamphetamine manufacture and use has continued to expand beyond the traditional markets in East and Southeast Asia and North America, to notably in Southwest Asia and in Latin America, and that you can see in the two maps that see at the top and the bottom. Methamphetamine manufacture and use has also risen in Afghanistan in recent years, and the drug is being trafficked to the wider region. Accounts suggest that use of methamphetamine is rising in Southwest Asia and beyond, in particular in Iraq. CU's data and other indicators in the Gulf suggest that a methamphetamine market may also emerge there. If you look at the Captagon market, the market for Captagon, which is an illicitly manufactured substance containing various concentrations of amphetamine, continues to flourish in the Near and Middle East, with CUs reaching the record high in 2020. The departure point for trafficking continues to be the Levant, the Syrian Arab Republic, and Lebanon, with destination in the Gulf countries reached either directly by land and sea or indirectly through Europe and possibly North Africa. Again, recent CUs in East Asia and West Africa point to further geographical expansion of the Captagon market. Moving on to the opioids, in North America, we see a opioid crisis where fentanyls are driving the opioid overdose deaths to new record highs. In the United States, the provisional estimate for 2021 was over 100,000 overdose deaths attributed to opioids and mainly fentanyls, whereas Canada reported a 95% increase in opioid overdose deaths in the first year of the COVID-19 pandemic. On the other hand, you have North and Western Africa, Middle East, and parts of Southwest Asia that face another opioid crisis caused by the non-medical use of tramadol. And along with all of this, what we see at the same time, that there is a great disparity within the high-income and middle and low-income countries in the availability and accessibility of controlled medications for pain management and palliative care. Finally, the spread of synthetic NPS in the period 2015 and 2020 has been particularly pronounced in countries in Eastern Europe and Central Asia and Transcaucasia. A recent trend in Latin America and the Caribbean is the emergence of blotting papers, stamps containing various NPS with hallucinogenic effects. NPS opioids are among the most harmful groups of NPS. The number of opioid NPS found on markets worldwide grew from just one substance in 2009 to 86 substances in 2020. In 2020, synthetic opioids were the third largest groups of NPS in terms of the number of substances reported by member states. With this, I conclude my presentation, and as we have been saying, there's wealth of information in the 5 booklets that you can access on the UNODC website. What I was able to present was just the snippets of some of the very important findings and highlights from that report. And again, I thank you for your patience and for listening to the presentation. Thank you very much.
Thank you, Dr. Niaz, for taking us through the findings of the World Drug Report 2022. Indeed, 2022, the world continues to witness the widespread humanitarian crisis in Afghanistan, Ukraine, and elsewhere, while the COVID-19 pandemic is still a major global threat. The synthetic drug crisis also requires nimble and adaptable solutions, as rightly highlighted in the presentation. A growing sense of global community and solidarity continues to emerge, as does the need to care for all in the times of crisis. Thank you very much. Now I would like to invite Ms. Joanna Campello. She is the chief at the Prevention, Treatment and Rehabilitation section at the UNODC headquarters in Vienna. So may I kindly invite Ms. Joanna?
I am here. I hope you can hear me. And honorable ministers, excellencies, representatives of the government of Pakistan, of civil society, academia, and private sector, dear colleagues and friends. I had the honor and great pleasure to follow the hard work that has been done by Dr. Niaz and his presentation. He highlighted some of the most interesting points from the new World Drug Report. As for me, I have the honor to highlight some of the responses that I believe are necessary if we want to address adequately some of the challenges that he has just emphasized for us. And let me start by something that Dr. Niaz mentioned at the very end of his presentation. He mentioned how we have data reporting how drug treatment and care services for people who use drugs and people with drug use disorder contracted, decreased, reached less people during the pandemic. And I want to start from there because I also want to remind you and remind ourselves that in previous versions of the World Drug Report, we had a picture that was not like drug treatment and care services were reaching a majority of the people who needed them. No, only 1 in 7 people with drug use disorder had access to treatment services before the pandemic. And we've just heard how the situation got worse. Also from the past, we know that while 1 in 3 women on average use drugs, only 1 in 5 is in treatment. And now we have the confirmation due to the excellent analysis of our colleagues in the research and analysis branch that this situation has not improved. And even we have now enough data to provide us with an in-depth overview of differences by region and substance. But the bottom line remains the situation for women who use drugs, women with drug use disorder, has not improved. And we have heard at the same time about markets expanding, cannabis, cocaine, methamphetamines. We have heard about youth using more. We have heard about more potent substances on the market. And at the same time, as often is the case, we have heard that patients that need controlled medicines, maybe for palliative care, because they're terminal patients, or for surgery, do not have access to them. And I think it is clear that we need to join forces to do better. We need to invest more in drug prevention and treatment that are based on scientific evidence and that are therefore actually effective. And as you know, UNODC and WHO, the World Health Organization, have summarized this scientific evidence in the international standards. We have those on prevention and those on treatment. And I'm very happy to be able to mention that thanks to the support of the United States of America, mainly, UNODC and the government of Pakistan have been collaborating for many years in training hundreds of service providers on both prevention, particularly in school, and on treatment and care, and training them in applying the evidence-based practice that is included in the standards by using the Universal Prevention Curriculum and the Universal Treatment Curriculum. So this is a very, very strong and solid basis for which hopefully we can build and expand. Moreover, I would like to underline how the government of Pakistan has been leading the way globally on the issue of quality of drug treatment and care. What happened was that UNODC took the international standards for the treatment of drug use disorder that we have published together with WHO, and we have just mentioned. And we have used them to develop a package of tools to develop mechanisms to ensure the quality of treatment and care services. I'm sure you will agree with me that if a loved one, somebody in our families was suffering for a drug use disorder, we would want that the services that they receive are of the highest standards and the highest effectiveness. And the package of tools that we have developed are aimed at ensuring just that. And UNODC has been incredibly honored to be able to work with Pakistan, and not only at the capital level, including a provincial level. In too many countries, we are only able to work in the capital. No, with the government of Pakistan, we have been able to go to the provinces in assessing the quality of the treatment and care system. Pakistan is the first country in the world assessing the national drug treatment system with our system tool, and using it to start strengthening the system. And as a follow-up, Pakistan has already reached out to UNODC to jointly work on the development of national standards for the treatment of drug use disorder and associated services. So we're really working together to respond to one of the challenges that have been presented to us by Dr. Miaz. And Pakistan is not stopping there. We are working specifically with the National Institute of Population Study in conducting a comprehensive national survey of drug use in Pakistan, what is sometimes referred to as a household service, and with the Phoenix Foundation for Research and Development on the study of high-risk drug use in community settings. And we think that this is a crucial initiative because a thorough understanding of the situation is necessary to plan and develop an adequate response. Excellencies, dear colleagues and friends, I only have the time to highlight these major initiatives, and it is clear that if we join forces, we can do so much more. I'm thinking, for example, we could respond better to the needs of children and families in difficult situations, maybe displaced, maybe challenged by economic hardship. We could respond better to the needs of young people and women with drug use disorders, especially when they are in contact with the criminal justice system. All of these are opportunities to build on the excellent work of the government of Pakistan and expand it. And in the occasion of the World Drug Day, let us celebrate achievement and commit to do even more, transforming crisis through care in opportunities for resilience and hope, health, and recovery. Thank you.
Thank you very much, Ms. Campallo. You're very right in enlisting that we have to work with all stakeholders, collaborating to get data to plan evidence-based interventions, whether it's prevention or the treatment of the drug use disorders. And it should follow the international standards for the drug prevention and treatment, and that is surely going to improve the quality of care for us. Now, the Ministry of Narcotics Control envisions a drug-free, healthier, and productive nation which is free from the peril of illicit drug use, trafficking, and manufacturing. I would like to invite Federal Secretary Ms. Humaira Ahmed at the Ministry of Narcotics Control for her keynote address on this occasion. Ms. Humaira Ahmed is an officer of Pakistan Administrative Services having an experience of over 32 years. During her services, she has served on various important assignments in the federal as well as provincial government and abroad, which also includes working in the offices of the Prime Minister and the President of Pakistan. Her recent appointments include serving as a Secretary, Public Service Commission, and the Secretary at the Ministry of Science and Technology. She has also served in Economic Affairs Division, where she has worked with many multilateral donor agencies, including World Bank, United Nations, Islamic Development Bank, Asian Infrastructure Development Bank. She has also worked with UNDP, UNESCO on various projects of reconstruction and rehabilitation in earthquake-affected areas during her time in Earthquake Reconstruction and Rehabilitation Authority, that's ERA. She comes with a diverse experience of administration and policy making in the field of finance, education, health, and community welfare. So, Madam Humaira, please.
Thank you. Thank you very much for the introduction. I'm very honored with the kind words. Federal Minister for Narcotics Control Division, Nawabzada Shahzain Bukti Saab. Mr. Jeremy Wilson, Representative UNODC Pakistan. Distinguished guests, Assalamu alaikum, and a very good afternoon to you all. I would like to start off by thanking UNODC for taking lead in organizing the events in commemoration of the World Drug Day and the launch of the World Drug Report 2022. In this report, the UNODC has mapped out the regional and the global situation pertaining to the drug production, transportation, and usage of illicit drugs. It's been highlighted in this report that around 90% of the heroin is produced in one of our neighboring countries. As per this report, there are three different routes, main routes of transportation of these illicit drugs. For Pakistan, it has been elaborated that the extent of seizure has doubled during 2019 to 2021, and this reflects positively on the effective command and control systems put in place by the ministry and the narcotics force that we have. And this force is spread all over Pakistan. We reckon it as a substantive improvement in this very difficult area where the stakes are very high, extremely high. Finances with people on the other side of the fence are innumerable, and the resources are unparalleled. However, the Anti-Narcotics Force with the Ministry of Narcotics Control Division has been doing a lot of good work, and we are happy that this has come out in this report as well. The World Drug Report has further highlighted that the latest estimates and the trends in the drug use regarding types of the drugs and the extent to which they are used and the associated harms among the people who use these drugs. There's also information on the extent of the illicit crop cultivation and trends in the drug production and trafficking, and this has been done in a very holistic manner. Ladies and gentlemen, cannabis remains the world's most used drug. An estimated 209 million people used cannabis in 2020, representing 4% of the global total population. Cannabis cultivation is reported to be on the increase. Seizures of the cannabis resin increased to a record high in 2020. Young people have a global annual prevalence of cannabis use of 5.8%. An estimated 61 million people have used opioids in 2020, representing 1.2% of the total world population. Of these, an estimated 31 million people mainly used opiates, that is heroin. Opioids are the most lethal group of the drugs, accounting for 2/3 of the deaths related directly to the drugs, and it's happening mostly through overdose. Opioids have contributed to 35% of the drug disorders. They've caused 77% deaths. Cannabis have contributed to 40% of the drug disorders, and they've caused 4% of deaths. Globally, the report estimates that 11.2 million people worldwide have been injecting drugs. Around half of this number has been living with hepatitis C. 1.4 million people have been living with HIV, and 1.2 million people have been living with both. It is also noteworthy that drug prevalence is much higher in men as compared to women. Pakistan's anti-narcotics policy has been formulated. It was formulated in 2019. We are currently working on its action plan. We propose that a comprehensive multi-sectoral cross-border response be evolved and taken into hand. On this International Day Against Drug Abuse and Illicit Trafficking, it is our request that all should come forward and join hands to make the world safe from this menace. We must make concerted efforts to bring awareness among the youth and to provide care for the people who have been undergoing this menace, so that they be rehabilitated. We must apprise our youth about the perils of this menace and take the first step forward in this direction. The first step has to be taken by the parents, and the society in general needs to follow up. On behalf of the government of Pakistan, I want to make the commitment of doing our duty, and I want to appreciate the good work done by UNODC by bringing out this report. This has provided us with a new benchmark for our future action plans. Thank you, ladies and gentlemen, and I'm very grateful to all of you.
Thank you, Ms. Ahmed, for highlighting the threats to the health and the security of all, more specifically the youth, and also highlighting the need of a comprehensive multi-sectoral response from various departments, sectors, and actors. Now, I would like to invite His Excellency, Mr. Nawabzada Shahzain Bugti, the Federal Minister of Narcotics Control, for his closing remarks. Nawabzada Shahzain Bugti has been a member of the National Assembly of Pakistan since August 2018. He served as a special assistant to Prime Minister on reconciliation and harmony in Balochistan. Currently, Mr. Bugti is serving as Federal Minister of Narcotics Control since April 2022. So, may I kindly invite Bugti sir?
Bismillah ar-Rahman ar-Rahim. Madam Secretary, Ms. Humaira, Mr. Jeremy, Representative UNODC Pakistan, dear dignitaries and officials from UN organizations, foreign missions, government departments, civil society, and distinguished guests. Assalamu alaikum and good afternoon. The International Day against drug abuse and illicit trafficking invites our attention to the dangers that drug pose to individual families, communities, and societies on whole. The unfortunate tendency of drug abuse amongst the youth in particular is a great challenge that requires prompt attention. I would like to take this opportunity to thank UNODC Country Office, Pakistan, for organizing this event, for extending support to commemorate International Day Against Drug Abuse and Illicit Trafficking and launch of the World Drug Report 2022. Each year, this day serves to remind us to express our resolve to achieve drug-free status not only for our country but also for the entire world. Cooperation across boundaries in the trend shows increased consumption. There is a need to expand gender-sensitive service for drug treatment and HIV prevention. Pakistan has a history of fighting the menace of drugs, and the role played by Ministry of Narcotics and Anti-Narcotics Force, ANF, is important and commendable. ANF continuously conducts successful drug seizures operations across the country, but the challenge of drug control is exacerbated due to constant innovation in synthetic drugs. I urge all stakeholders to remain steadfast in their efforts to achieve the goal of drug-free nation, region, and world. I also call upon the international community to play an even greater role toward checking abuse of narcotics and putting an end to both demand and supply. On the International Day Against Drug Abuse and Illicit Trafficking, Pakistan reaffirms its commitment to fight the abuse of illicit drug trade of narcotics and psychoactive substance with even greater resolve and commitment. Thank you, gentlemen.
Thank you, sir. Thank you for accentuating the commitment to have a drug-free nation, region, and the world, and it requires all stakeholders' commitment and involvement. So, inclusion towards the end, we can say that we are committed to provide care and support to the people affected by illicit drugs. And the drug prevention and drug treatment in line with the international standards of the drug prevention and treatment are the need of time. This is the one way to reach the quality in drug prevention and drug treatment services. This will now conclude, and we thank you all for joining us, and the lunch is served at the end. Thank you very much.